Okay, so this lesson today is on ways to prevent pregnancy. So these two vocabulary words kind of can be interchangeable. Contraception is the interference with successful fertilization of an ovum. So interfering with the egg and the sperm actually meeting by chemical, physical, or surgical methods. Birth control, on the other hand, are ways to alter the conditions necessary for conception and or pregnancy to occur. So birth control is abstinence, although contraception is the items that are used, basically condoms and that sort of thing, to prevent that during intercourse, to prevent fertilization happening. We can put these methods into three different categories. The first is a barrier method. The barrier method is something that puts a physical wall between the sperm and the egg so they cannot join. So the sperm can't even find the egg. It's not even let loose inside. The hormonal methods, they help in three different ways. They prevent ovulation from occurring. So they prevent the egg from even leaving the ovary. It thins the uterine lining. And because the uterine lining gets so thin, a lot of the hormonal methods reduces the amount of period blood that a woman loses each month during their menstrual cycle. But also the thin lining of the uterus makes it kind of a hostile environment for the egg, the fertilized egg, which is a zygote, to implant into the uterus. So if without that lining, the egg would just would disintegrate and fall out of the body with the blood from the period. The third thing it does is it thickens the cervix, the mucus in the cervix. So the cervix, which is the opening between the vagina and the uterus, has mucus on it. And what the hormonal methods do is actually makes that really thick so that the sperm get kind of trapped in there and can't swim through there to get up to where they want to go. Other methods is anything that doesn't fall into one of these two categories. For our purposes, we're actually going to discuss only one barrier method, and that is condom use. This is the only form of temporary birth control available for men. This method is a thin latex sheath that's placed over the penis and prevents the sperm from entering the vagina. It is pretty effective, but there's a bit of a range, 86% to 97% effective, and I will explain why there is a range in just a second. The advantages are it's available without prescription and very easy to obtain, and it does protect against most, but not all, STIs. The disadvantage is that it can break, especially if it's not stored correctly or if it's too old. So the right way to use a condom is to use it every single time sexual intercourse takes place. You have to put the condom on before having sex. You can't stop in the middle of it and then put the condom on because it doesn't necessarily work. At one point you learned about the word pre-ejaculatory fluid. Before ejaculation, there is some fluid that comes out of the penis, and that's again called pre-ejaculatory fluid. So if the penis enters the vagina at any point, even before ejaculation, then that little bit of fluid can come out and can have sperm in it and can cause pregnancy. Read the package and check the expiration date. They break down if they get too old and they don't work. Make sure there are no tears or defects in the condom. Make sure that they are stored in a cool, dry place. Moisture and heat, like in a vehicle or in the sunshine somewhere, will break down the condom. Using latex or polyurethane condoms, there are different types out there, but they are not nearly as effective, and some don't stop STIs at all, but some are less likely to also stop pregnancies from happening. So making sure you have the right type of condom is very important. And then using a water-based or silicone-based lubricant to prevent breakage is also the proper use of condoms. The next category of birth control methods are hormonal methods. So as the name would suggest, these are using hormones or estrogen, which is the female hormone, to prevent pregnancy. The most common is the pill, and the pill is a little pill taken every single day. It works about 99% of the time against pregnancy. So it's very, very, very effective as long as it's taken properly. So it has to be taken every single day at the exact same time. And any type of strain from that schedule can decrease the chances of it working properly. Advantages is that it can also reduce menstrual cramps, and even help out with if somebody has severe mood changes. It can also level the mood changes during periods as well. It also reduces the risk of ovarian cancer. A disadvantage can be that it does cause weight gain, and you must have a prescription to get it, and it doesn't protect at all against STIs. There's another hormonal birth control method called the Depo-Provera, which is also it's just a shot. So it's a shot that's injected into a woman's body every 12 weeks, so every 3 months. And this is also 99% effective against pregnancy. It does not need to be taken daily, which is an advantage, but it does require a prescription, and you do have to get a shot every 12 weeks. It does not protect against STIs and can cause some weight gain and can cause some spotting, which is bleeding between periods. IUD is actually the most common or most effective birth control method, and the least expensive when it comes to because of the long term of it. So it is 99% effective, or more than 99% effective against pregnancies. It is literally just a T-shaped plastic piece that gets put into the uterus. Sometimes it's copper, but it irritates the lining of the uterus, so it makes kind of a hostile environment for the uterus, but it also releases hormones. It is the least expensive and longest lasting birth control pill. People can leave the IUD in for up to 12 years. It can reduce cramps and make the period lighter, and for some women, their period stops entirely. The disadvantages are sometimes there's mild to moderate pain when it's inserted. So you do have to go to a doctor and have it inserted into the uterus, and it can't come out either without a doctor. So the doctor will have to go up and get it back out. You can get cramping or backaches for a few days, just like regular cramps when having the IUD put in, spotting between periods or maybe irregular periods for 3 to 6 months, and it doesn't help at all against protecting against STIs. All right, so the next one is an implant. This is a flexible plastic tube inserted into the upper arm. It releases hormones, and it can actually be in there for 5 years. The effectiveness is 99% effective. Yes, you can feel the implant once it's in the arm, but it goes in the inner side of the arm, and it's a little surgical process to get it in there. They would numb it, cut a little hole in your arm, stick that tube in there. Once it's implanted, the advantage is that it works until it's removed, or within 5 years. If the 5 years is up and you don't have it removed, the hormones won't last any longer than that, so pregnancy can occur. It does reduce period cramps. It causes lighter periods. The disadvantages, besides having a little bit of minor surgery, it may cause irregular menstrual cycles, or it could cause spotting. Some people get weight gain. And again, this does not prevent against STIs. The Nuva ring is a small flexible ring that gets inserted into the vagina once a month. So this is a prescription, but the female puts it into her vagina once a month, and takes it out at the beginning of the 4th week for the period to still happen. That it prevents ovulation and thickens the cervical mucus. It is 99% effective against pregnancy. The advantages are that it gives a lighter and more regular period. It's very, very safe. It's very easy. It's very convenient. It's very easy to use. It may cause bleeding between periods. It could also cause breast tenderness, some nauseousness, and possible vaginal irritation, because that little ring actually sits right inside the vagina. And it does not protect against STIs. The contraceptive patch. If you've ever seen anybody use a nicotine patch, it works just like this. It's like a Band-Aid, but without the poofy bandage part. It is a birth control patch that just sticks to the skin. It's left on for 3 weeks and then taken off for that 4th week to have a period for 1 week. And again, if it's used correctly, it is 99% effective. The advantages, just like the rest of the hormones, lighter and more regular periods. It's very safe, very convenient. Disadvantages is it can cause skin irritation. If you happen to get a little allergic reaction to bandages, you're going to have an allergic reaction to a patch. It can cause bleeding and spotting between periods, and again, does not prevent against STIs. And then the last section is other methods, something that doesn't fit into the barrier or it doesn't fit into the hormonal methods. And the first is abstinence. That means just not doing it, waiting or refraining from all forms of sexual activity. It's 100% effective for both pregnancy prevention and preventing STIs. It is, the advantages are that it's 100% effective. There's no side effects. There's no costs. The disadvantages is one partner may not want to remain abstinent. So that could be an argument and a problem between partners. The other method that fits into this is withdrawal, which is just removing of the penis from the vagina before ejaculation occurs. This is not a form of birth control. The penis does secrete pre-ejaculatory fluid that can contain sperm and can cause pregnancy to occur. The effectiveness is only 50 to 80%. It's literally like flipping a coin. Are you going to get pregnant? Or are you not? The advantages is that there's no hormones or devices used. If you are willing to get pregnant, if that is not something that is going to interfere with your life plan, maybe you've already have kids, this is fine. However, if you're even thinking, I'm not really sure, this is not a method of birth control. There is it's very, very little effective in preventing pregnancy. It's with the major disadvantages. And of course, it doesn't protect at all against STIs. And it does require more self-control than most young men and some older men can even handle. Withdrawal, the point is that right before ejaculation that the penis gets removed from the vagina. And the last one that fits under this other is vaginal spermicides. So these are things that kill sperm. There are foams, or creams, or jellies, films, suppositories, which are like pills that go up into the vagina. They contain a chemical that kills the sperm. And since the chemical kills the sperm, then the sperm die before going into the uterus. It has to be inserted into the vagina before intercourse, and the package must be read and directions followed because it has, for different types, it tells you the different timelines, like how far before intercourse does it have to be used. When it's used correctly, it's 74 to 95% effective, so not really great effectiveness, but in addition to some other type of form of birth control, because you can use more than one at a time, it does increase the effectiveness. The advantages is there's no dangerous side effects and there's no prescriptions needed. You can get this from any pharmacy. The disadvantage is it may cause vaginal irritation. Some women are actually allergic to it. Men could be allergic to it as well, and does not protect against STIs. All right, so if we put these into categories, the barrier method was the only thing was condom. And that is the only one of all of them besides abstinence that even starts to reduce the risk of STIs. Hormonal methods include the pill, the shot, the IUD, the implant, the ring, and the patch. Other methods include abstinence or not having sex, vaginal spermicides to kill the sperm, or withdrawal method, which is pulling the penis out before ejaculation.